Now to health matters. The federal government has been advised to supplement treatment of spine-related diseases to ensure full functionality of the nation's workforce. This was part of discussions at a workshop organized for 5 categories of doctors in Lagos State today. Senior correspondent Jacqueline Ogo reports.
It was an intensive workshop put together by Cedar Crest Hospitals aimed at upscaling the competencies of doctors on the conservative management of spine disorders. Thus talking about the treatment of lower back pains without patients undergoing surgical operations. Doctors say spine disorders cause patients a lot of discomfort. And there is a wide range of causes, as explained by the organizers of the workshop on the sidelines.
Injections do have a lot of ways they can help back pain. So basically when you do these injections, you're giving particular types of drugs in the location where the problem is causing pain. And there are ways that we use equipment to target where we're actually injecting, so that you actually drop the drug in the location of the cause of pain. We found over time that when you do this, you most times can actually cure the patient's pain.
There are some pretty sinister causes for back pain. One example that readily comes to mind is that there are some cancers that in their later stages will spread to the spine and will present as back pain. So maybe the last parting shot will be, if you have back pain, please get it checked out.
The German orthopedic surgeon Axel Rutz, who was the keynote speaker, advised the federal government to put more weight behind subsidizing spine treatments to ensure lower back pains do not keep workers back at home, taking away the highly needed man-hours for national development.
It must be in the opinion of the government to support people not to get chronic pain and to make it possible with treatments. It's now with a high budget to prevent people from chronic low back pain.
It was also suggested that doctors could investigate the deployment of the gene therapy as a faster non-surgical treatment pattern. A medical attendee spoke of good takeaways.
It is something that if you address effectively, you're going to see a lot more people that are happy, they're living pain-free, meaningful lives, all right? You're going to see a lot of people who are more productive.
Several non-surgical medical options were discussed in the workshop. But like the keynote speaker, Dr. Ruth said, the aim is to ensure that patients are well treated and restored back to full functionality in life. Jacqueline Ogo, TVC News, Lagos.